Hi, this is Dr. Adahar from Chicagoland Men's Health, and I'm here to talk about our peptide human growth hormone program using CJC1295 and Ipamorelin. Okay, so to start, CJC125 and Ipamorelin, these are two peptides that help stimulate your pituitary gland to release a maximum amount of human growth hormone. Now, one of the questions is, what is a peptide? A peptide is a special combination of amino acids that tell your body to do a certain function. There are many peptides already out there that you're probably familiar with, such as the insulin medication, which is a peptide. So, CJC1295 and Ipamorelin are peptides which will tell your pituitary gland to release a large amount of human growth hormone. Now, the medication we use is a blend, which the reason for that is that because they're complementary in their effects, that the combination of the two will result in a greater release of human growth hormone than using each one individually. The CJC1295 acts on one part of the pituitary gland and the Ipamorelin acts on the other, so they're very complementary. Now, the question is, what's the benefit? So, in general, it's the benefit is several. It maximizes your human growth hormone level. Now, what that does is when your human growth hormone level is elevated for some time, the expected benefits are several, such as increased recovery between workouts, even as dramatic as increased recovery between exercises, increased repair of any musculoskeletal injuries, decreased joint pains because it rebuilds and relubricates the collagen in your joints and relubricates them. You have a easier fat mobilization and increased lean body muscle mass. So the scale may not change, but your body fat percentage will go down, and your lean muscle mass will go up. So it's more of a body recomposition type thing. Even if you decide to go on a cut or go on a severe calorie restriction, it prevents the loss of muscle mass because normally with every 1 pound loss during diet, up to 20% of that is muscle. So that use of human growth hormone will mitigate that. Also, your sleep is much improved. It will get you to your deep REM sleep faster and keep you there longer. So if you sleep only 5 or 6 hours a night, you will wake up as if you slept 8 hours because of the increased time in your REM sleep. I think it slows down the aging of your internal organs, slows down the degeneration of your eyes, increases nail and hair growth, rebuilds the collagen in your skin so you maintain a youthful appearance. Now, are there any side effects? Now, with pure human growth hormone, yes, there are definitely side effects. You can get, abnormal growth of internal organs. You can get what we call acromegaly, or widening of the brow from abnormal bone growth. You can get diabetes. You can get carpal tunnel syndrome from abuse of human growth hormone. Now, with peptide therapy, the nice thing is that you can't overdose on it because your body it revs up your internal workings, and so there's no external administration of hormone, so that all you're doing is really revving up your own body. And the benefits of that is, number one, you can't overdose on it. You can give yourself the whole bottle and there won't be any difference. Number two, the side effect profile is very low because it's your own human growth hormone that we're stimulating. Let's see, I think, basically that's about it. Now, there are some precautions. For example, like if you are somebody who has a history of cancer or are being treated for cancer, you would be somebody we would not start peptide therapy on, because theoretically the human growth hormone can speed up the growth of the cancer cells. So you would not be a candidate. people who have a history of nightmares, or frequently, we would be very cautious. So I recommend that you don't start human growth hormone because it does make your dreams very vivid. Other than that, there's majority of people are well suited for it. Blood monitoring for it is not necessary. So a lot of great benefits. When you use it with testosterone therapy, they're actually synergistic in their effect. So they work well. When they're used together. Your benefits from each is more when used together than testosterone or peptide therapy alone. Now the question is how's it administered? So it is administered 5 out of 7 days of the week, Monday through Friday, not Saturday, Sunday, because you have to give your pituitary gland a chance to recover from using it. Also, try to avoid any food within 60 minutes of administration, because the carbohydrates and fats in your meal can deactivate the peptide in your blood. And it's injected at night, right before you go to bed, because it maximizes your human growth hormone spike, which occurs. Your main spike is approximately 1 to 2 hours after you fall asleep, and the medication is designed to maximize that growth spurt. Now, a second alternative is doing it first thing in the morning before you eat anything, because that's your second biggest growth spurt, human growth hormone released during the day. It's not as big as the one at night, but it is the second biggest. And you should probably wait around 15 to 20 minutes after injection in the morning before you eat something. All right. Now, the question is how to inject it. Okay, so you will be provided a bunch of several insulin syringes, some alcohol, and then the CJC medication. Your vial may not look like this. Okay. The dose is 0.10 cc's a night, so you would be up to that, up to this one, 0.1, or up to the 10 line. Okay, so that would correspond with 0.1 cc's. Okay, now what you do, you take your alcohol pad. You take an alcohol pad. Take the top of your bottle. Make sure you wipe it off. Even after first use, after you pop the cap, you should wipe it. Okay. And then you will take the medication. It's already pre-mixed, nothing for you to do. Again, your vial might be smaller than this one. And you go up to 1. I think I got up to 1 there. 1. Awesome. Okay, now you would, pardon me. Okay, so around the belly button, you would wipe an area clean. You pinch firmly. And then you just 1, 2, 3 inject it, and then you push just like that. Okay, and I depress the whole thing. Okay, and you pull it out. That's it. All right, and you recap this and you toss it, and you're good to go. Okay, so that's a video on CJC Ipamorelin. If you have any questions, you can call us at Chicagoland Men's Health, or leave a comment below, and we'll do our best to try to get back to you. Have a great day. Thank you very much.